In the underground world of biohacking and pro sports, there's this compound that people whisper about. It's not a steroid, it's not some crazy hormone, it's a peptide called BPC-157. And the stories you hear about it, they sound like something straight out of a comic book. We're talking near superhuman levels of healing. So today, we're going deep on the science, the hype, and yeah, the very real risks of this molecule.
But let me just start with this. What if you could recover from a nasty injury, a torn muscle, a ruptured tendon, maybe even a broken bone, in like a fraction of the normal time? I know, it sounds like total science fiction, but that is the incredible promise that has put BPC-157 on the radar for so many people.
But here's the thing. This story, it didn't just pop up on TikTok. No, its roots go way back, decades ago, in a research lab. So let's do this. Let's peel back all that online hype and see what the actual science, the preclinical evidence, really has to say. Okay, so what exactly are we even talking about here? BPC-157 is a synthetic peptide, basically a small chain of 15 amino acids. But here's the part that's going to blow your mind. It's a piece, a fragment, of a protein that researchers first found in our own stomach acid. I mean, think about that. The idea was, well, if this thing can protect our gut from all that corrosive acid, just imagine what it could do for other parts of the body. And when they tested that theory in animal studies, wow, the results were just incredible. It's like BPC-157 acts as a master switch for regeneration. It cranks up key healing signals. It activates these pathways that are kind of like a GPS for your body's repair cells, telling them exactly where to go. And get this, it even tells the cells that build new tissue to put out more docking stations for growth hormone. It's like a 4-star general screaming, "Mobilize" to the body's repair crew. Yeah. And it doesn't stop there. Think about it. To heal anything, you need a supply line, right? You need blood vessels to bring in the good stuff. Well, in the lab, these preclinical models show that BPC-157 kicks off something called angiogenesis, which is just a fancy word for building brand new blood vessels. This could be a total game changer for injuries in places that don't get a lot of blood flow, like our tendons and ligaments. You know, the stuff that takes forever to heal. And on top of all that, it seems to be a really potent anti-inflammatory. You know how after you get hurt, the swelling and inflammation can sometimes get out of control and actually slow things down? Well, in these animal models, BPC-157 just dials it way back. It's like it tells the body's cleanup crew to stop the aggressive demolition and switch over to a much more focused rebuilding mode. It's pretty cool.
And when you look at the results from the animal studies, it is frankly mind-blowing. I mean, we're talking about rats with completely severed Achilles tendons healing way faster, torn quad muscles mending back together, even pieces of bone that were removed showing accelerated repair. And it doesn't stop there. The studies suggest it helps nerves recover, heals ligament tears, and can even protect our vital organs. It's wild.
Okay, those results are spectacular. It sounds like a miracle cure just waiting in the wings. But this is the exact moment where we have to slam on the brakes and separate what happens in a lab with rats from what we know about real-world medicine. This is where we run smack into the great evidence divide.
So a huge systematic review came out in 2024. Researchers decided to gather every single piece of research ever done on BPC-157 for muscle and bone injuries. They searched everything from 1993 all the way to 2024, and they found a grand total of 36 relevant studies.
But here is the catch, and it is a massive catch. Out of those 36 studies, the entire scientific backbone for this compound, a staggering 35 of them were done on animals, mostly rats.
Which leaves us with exactly one study conducted on actual human beings. And it wasn't some big, fancy, controlled trial. It was a tiny, retrospective look at just 12 patients who had knee pain. That's it. That is the sum total of published human clinical data we have.
In this timeline, it just tells the whole story, doesn't it? BPC-157 is discovered in the early 90s. For the next 2 decades, we get this flood of amazing animal research. Then, in 2015, a little glimmer of hope. A Phase 1 human safety trial is officially put on the books. But just a year later, poof, the trial status goes dark. No results were ever published. The entire official pipeline for human data just ran dry.
Now, to really understand both the incredible promise and the potential danger of BPC-157, we have to look at its main trick. Because the very thing that makes it a potential super healer is also the source of its single biggest theoretical risk. It's a classic double-edged sword.
The key process we're talking about is angiogenesis. That's just the body's way of building new blood vessels. You know, when you get a cut or you tear a muscle, you need angiogenesis to create new supply lines for blood to bring in all the repair crews and materials. And BPC-157 is a really powerful stimulator of this process.
And that, right there, presents a truly frightening paradox. The exact same mechanism that fuels rapid repair is also a mechanism that tumors hijack to grow and spread. Tumors are greedy. They need their own blood supply to get bigger, and they do that through angiogenesis. So, by stimulating key growth factors, BPC-157 could be amazing for healing a tendon. But what if it's also feeding a tiny, undiscovered tumor somewhere in your body? And look, this isn't just some vague fear. Researchers have explicitly sounded this alarm. This quote from a 2024 review just lays it out in plain English. The very pathways that BPC-157 is known to crank up, like VEGF and EGR1, are often the same pathways that tumors use to grow and become more dangerous. But, and this is where it gets absolutely wild, other research points in the complete opposite direction. This quote from another 2024 paper suggests BPC-157 might actually inhibit that uncontrolled growth and fight back against the tumor-driving pathways. So which is it? Is it a fire starter or a firefighter? Without human trials, that contradiction is just dangerously unsolved.
So what happens when the official science gets stuck in mud? Well, human nature and the internet take over. An unregulated, global, and totally uncontrolled experiment has just exploded online, with people chasing that promise they saw in all those animal studies. Welcome to the Wild West.
So, okay, to sum up, we've got all this incredibly promising data from the lab, but this is the point in the story where we leave that clean, controlled environment and step into the Wild West. We're talking about online forums, athletes, biohackers, the real world. And because there's zero official medical guidance, none, what we've seen is this explosion of what you could call folk pharmacology. You have thousands of people online sharing what worked for them, what didn't, and creating their own protocols for how to use this stuff. For torn muscles, bad joints, you name it, it's basically one giant, completely uncontrolled public experiment. That's exactly right. As BPC-157 started going viral, you better believe the big regulatory bodies started paying attention. And that world of online hype, well, it was about to slam headfirst into the brick wall of drug regulation. And yeah, that collision came fast and it came hard. In 2022, the World Anti-Doping Agency, WADA, put it on their prohibited list, banning it for all athletes. Then, just a year later, in 2023, the US FDA restricted it from being used in compounded medications, you know, those custom mixed prescriptions you can get. And they pointed directly to the lack of safety data. It was like a 1-2 punch from the world's biggest regulators. And this is where things get really risky, because it's not a regulated drug. Anything you find for sale online is coming from this total gray market. There's no oversight. It's not being made to proper pharmaceutical standards. So you truly have no idea what's in that little vial. Is it the right dose? Is it too little? Is it even BPC-157 at all? And what's really scary is that studies on similar unregulated products have found that up to 58% of them were contaminated with something else. So when you hear about people online reporting side effects like anxiety or heart palpitations, you have to wonder, is that from the peptide? Or is it from some nasty contaminant in a poorly made product? You just don't know.
So where does all of this leave us? We've got this mind-blowing potential on one side, and on the other, this massive black hole of human data, plus some really scary risks. So what's the final verdict here?
Honestly, the most rational position you can take is one of cautious optimism. The evidence from dozens of animal studies is just too powerful to write this stuff off as snake oil. It clearly does something pretty profound. But at the same time, without that human data, using it is just a complete leap of faith into the great unknown.
Bottom line, the science has to catch up to the hype. We desperately need proper, large-scale human trials to actually confirm if it's safe and if it really works. We need more research to solve that terrifying angiogenesis paradox. And until that happens, anyone using BPC-157 today is, whether they like it or not, a volunteer in a global, uncontrolled experiment.
And that leaves us with the one final unanswered question. Is BPC-157 a truly revolutionary leap forward in medicine, a genuine game changer for how we heal? Or is it just a dangerous game of bio-roulette? For now, the answer to that question remains locked away in the clinical trials that have yet to be done.